Every single morning, without realizing it, millions of people over 60 are doing something in the first 30 seconds after waking up that silently stresses their heart in ways their doctor has never warned them about. Not smoking, not eating poorly, not skipping medication. Something far more ordinary than that. Something so woven into the fabric of daily routine that it has become invisible, and that invisibility is exactly what makes it dangerous. I want you to think about this morning. Your alarm went off. What did you do next? Did you reach over, silence it, and swing your legs off the bed? Did you push yourself upright in under 3 seconds and head straight for the bathroom? If you did, you are not alone. In fact, you are in the vast majority. And by the end of what I am about to share with you today, I believe you will never begin another morning the same way again. Not out of fear, out of understanding. Because once you truly understand what is happening inside your body in those first moments after waking, the choice to change becomes not just logical, but urgent. My name is Dr. Sandrine. I have been a physician for more than 2 decades, and for the last 15 years, my practice has focused almost entirely on health after 60. I have sat beside patients in recovery rooms. I have reviewed the records of men and women who did everything right by conventional standards, and I have asked myself the same question again and again. Why did this happen to someone who was doing so well? The answer, more often than I can comfortably count, traces back not to diet, not to genetics, not to missed medications, but to a sequence of ordinary morning behaviors that no one ever thought to question. That is what I want to talk to you about today. Deeply, honestly, and completely. Because you deserve to have this conversation now, before it matters in the worst possible way. Let us start at the very beginning. Not with the alarm, not with the bed, but with the hour before you even open your eyes. Because that is where the story truly begins, and most people have no idea it is already unfolding. While you sleep, your body operates in what I sometimes describe to my patients as its maintenance mode. Heart rate slows, blood pressure drops, the nervous system quiets. Your cardiovascular system, which has been working without pause every minute of every hour of every day of your entire life, gets its closest approximation to genuine rest during those sleeping hours. It is a biological gift, that nightly recovery. And it is a gift that becomes more precious and more fragile as we age. But here is what almost no one tells you. Roughly 60 minutes before you become fully conscious, before your alarm sounds, before your eyes open, your brain begins preparing your body to wake up. And the way it does that preparation is by releasing 2 powerful stress hormones directly into your bloodstream. Cortisol, adrenaline. These are not harmful substances. They are essential. They are what allows you to function, to respond, to move through the world with energy and alertness. But in the context of the morning, in the specific biological landscape of a body over 60, their arrival sets in motion a sequence that carries real cardiovascular risk. Within seconds of that hormonal surge beginning, 3 things happen to your heart and your vessels, almost simultaneously. Your heart rate begins to climb, your blood pressure starts to rise, and your blood vessels, the arteries and the smaller vessels throughout your body, begin to constrict, to tighten, in preparation for the demands of wakefulness. In a younger cardiovascular system, 35 or 40 years old, this is handled beautifully. The vessel walls are elastic and responsive. The heart is strong and adaptive. The surge lands, the system adjusts, and within moments, everything stabilizes at its new waking baseline. The whole process is seamless, nearly invisible. After 60, the picture is fundamentally different. And this is not a failure. This is simply the honest physiology of an aging cardiovascular system, and it deserves to be understood clearly, without shame or alarm, but with clear eyes. The arteries of a person over 60 are measurably stiffer than they were at 40. This is not always a sign of disease. It is often simply the biology of time. Collagen accumulates. Elastin breaks down. The vessel walls lose some of their youthful flexibility. And in many people who feel perfectly well, who walk regularly, who take their medications faithfully, who had a clean checkup 6 months ago, there is plaque. Silent plaque. plaque that has been building slowly inside those vessel walls for years, perhaps decades, without producing a single symptom, without announcing itself in any way. Now add the morning cortisol surge to that picture. Blood pressure rising, heart rate climbing, vessels constricting, and the force of blood moving through arteries that are stiffer, and in many cases carrying that silent plaque, increases sharply in a very short period of time. If the plaque is vulnerable, if it has reached a particular fragility in its structure, that sudden mechanical force can crack it. And a cracked plaque triggers the body's clotting response. A clot forms. If that clot occurs in a coronary artery, the vessels that supply blood to the heart muscle itself, what follows is a heart attack. If it occurs in a cerebral artery, a vessel supplying the brain, what follows is a stroke. This is not a frightening story I am telling you. This is the mechanism. This is the biology that explains why multiple large studies, including research published in the American Heart Journal, show that cardiac events are significantly more likely to occur between 6 and 10 in the morning than at any other point in the day. The morning is not random danger. It is a specific, predictable, biological window of vulnerability. And once you understand why, you can do something meaningful about it. I want to introduce you to someone I will call Marguerite, 71 years old, retired school teacher, the kind of woman who had always taken her health seriously. She walked every day without fail, rain or shine. She took her blood pressure medication at the same time every morning. She had her cholesterol checked annually, her cardiac function reviewed, her weight managed carefully for years. By every measure her doctors applied, she was doing well. Better than well, in fact. Her cardiologist had told her at her last visit that her numbers looked good for her age. One morning, like every other morning, Marguerite's alarm went off at 7. She reached over to silence it, pushed herself up immediately, sat upright in under 3 seconds, swung her legs off the bed, stood up, and took 2 steps toward the bathroom. That was as far as she went. Her husband, who had been lying beside her, said she made a small sound, almost like a surprised exhale, and then she was on the floor. When I reviewed Marguerite's case, I kept returning to the same question I have returned to so many times before. Everything she was doing was right. Medication, exercise, diet, monitoring, follow-up, everything. And nobody, not one of her physicians across all those years of careful care, had ever asked her about those first 30 seconds of her morning. Nobody had ever talked to her about what her body was already experiencing before she even became fully conscious. Nobody had given her the 90 seconds that might have changed that morning entirely. That conversation, the one that comes too late or just in time depending on which side of it you sit, is the reason I am speaking to you today. So let us continue, because there is a second layer to the morning danger that is less well known and, in some ways, even more surprising. And I want to make sure you understand it fully before we talk about what to do. You have been sleeping for 7, 8, perhaps 9 hours. Your body has been breathing throughout that entire time, steadily and continuously, releasing moisture with every exhale. You have not had a drop of water since before you fell asleep. And the result, by the time your alarm sounds, is something that most people over 60 never think to consider. Your blood is thicker than it was the night before. Measurably, meaningfully thicker. I use a simple image with my patients when I explain this. Think of your cardiovascular system as a pump connected to an intricate network of pipes. When the fluid moving through those pipes is thin, free-flowing, well-hydrated, the pump moves it easily, efficiently, with relatively little effort. But when that fluid becomes thick and viscous, the pump must work harder with every single beat. Every contraction of the heart muscle must push against greater resistance. And that increased workload does not happen in isolation. It happens precisely on top of the morning cortisol surge, the rising blood pressure, the vessel constriction, everything arriving together, all at once. But the thickening of blood is not only about workload. There is a clotting dimension that deserves its own moment of attention. Research consistently confirms that the activity of clotting factors in the blood, the proteins and platelets responsible for forming clots, is measurably elevated in the early morning hours. Your blood, in that window between waking and the first hour of the day, is biologically primed to clot more readily than at any other time. In normal circumstances, this is not dangerous. But in the presence of a cardiovascular system already under hormonal stress, already working against stiffer vessels, already carrying plaque that may be vulnerable, that heightened clotting tendency becomes one piece of a genuinely serious picture. 3 simultaneous forces. The cortisol and adrenaline surge pressing against your vessel walls. The orthostatic challenge of standing up, which we are about to discuss in depth. And thicker, more easily clotting blood. Doctors sometimes call this combination a perfect storm. I prefer to call it a predictable storm because predictable means preventable. And prevention is exactly what we are here to talk about. Now let us go back to the alarm. It has sounded. You are lying in bed, and the hormonal wave is already in motion. What happens next, in the next 25 seconds, shapes the cardiovascular experience of your entire morning in a way that most people are completely unaware of. When you are lying flat, your blood is distributed relatively evenly throughout your body. The heart pumps efficiently in that horizontal position. The pressure relationship between your heart and your brain is balanced in a way that requires minimal compensation. The moment you move from horizontal to vertical, everything changes. Gravity immediately begins pulling a significant volume of blood downward, into your legs, into your abdomen, away from your heart, away from your brain. In a healthy, younger cardiovascular system, the reflex response to this is almost instantaneous. The blood vessels in the lower body constrict rapidly, pushing blood back upward. The heart rate adjusts. Blood pressure to the brain is maintained within seconds, and the person stands with no awareness that any of this has even occurred. It is one of the body's most elegant automatic systems. After 60, that reflex slows down. Not dramatically, not in a way that feels catastrophic from the inside, but measurably, meaningfully slower. The vessels do not constrict as quickly. Blood pressure to the brain can drop 10, 15, 20, in some people 30 points, in the seconds immediately following standing. Medicine has a name for this: orthostatic hypotension. And while the term is clinical and precise, what it actually feels like from the inside is something far more familiar to many of my patients. A gray, slightly swimmy sensation. A moment of visual blur or darkening. A feeling of unsteadiness, of not being quite present, that passes within seconds. Many people over 60 experience this regularly. And what I hear again and again in my consultations is this: they assume it is normal. They have done it so many times that they have simply incorporated it into their understanding of what mornings feel like. Some of them even joke about it. I just need a moment to get my bearings in the morning. And I always respond the same way. What you are describing is not a personality quirk, it is a symptom. And it is telling you something important about the stress your cardiovascular system is under at that specific moment. Because here is the piece that completes the picture. When blood pressure drops suddenly after standing, the heart does not simply wait for the situation to resolve. It compensates aggressively. It spikes its rate and its output in an attempt to restore circulation to the brain as quickly as possible. In a heart that is already under the stress of the morning cortisol surge, already working against thicker blood, already navigating stiffer vessels, that compensatory spike is not a neutral event. It can trigger an arrhythmia. It can push a vulnerable plaque toward rupture. In the most serious cases, it can initiate the exact sequence of events that ends in the emergency department. Standing up in under 3 seconds, something most people do every single morning without a second thought, is the 25-second mistake. And the reason I call it a mistake, rather than a risk, is because it is completely and entirely avoidable. With no equipment, no prescription, no cost, just knowledge, and the discipline to apply it for 90 seconds every morning. Before I give you the complete protocol, I want to pause for a moment and address something I hear frequently from patients when I explain all of this to them for the first time. They say, "But Dr. Sandrine, I have been doing this for 30 years and nothing has happened." And I understand that response completely. I genuinely do. It speaks to something deeply human, the way we interpret the absence of consequences as evidence of safety. But I want to offer you a different way of thinking about it. The cardiovascular system is extraordinarily resilient. It can absorb insult, compensate for stress, and adapt to challenge in ways that are genuinely remarkable. But that resilience is not infinite. And in the biology of aging, the margin between compensation and decompensation narrows. Every year, the vessel walls are a little stiffer. The clotting factors are a little more active. The orthostatic reflex is a little slower. The plaque, if present, grows a little larger. The system continues to compensate, continues to adapt, right up until the morning it cannot. And the tragedy I have witnessed so many times in my career is that the person who experiences that morning often had no warning, no crescendo, no announcement, just an ordinary Tuesday, an ordinary alarm, an ordinary rush to stand up, and then a morning that changes everything. You are here, in this conversation, on the side of the morning that has not happened yet. And that is a gift. So let us use it well. The complete morning protocol I am about to give you takes 90 seconds. That is not a metaphor or an approximation. Measured precisely, 90 seconds. It requires nothing you do not already have. It asks nothing of you that requires physical effort or discipline beyond a moment of conscious attention each morning. And the research supporting its components, including a significant study published in the Journal of the American Medical Association examining cardiovascular outcomes in adults over 60, suggests that consistent application of these principles can reduce the risk of early morning cardiac events by a magnitude that is genuinely remarkable. Let me walk you through each step with the care it deserves. The moment your alarm sounds, do not move. I know that sounds almost impossibly simple, but stay exactly where you are. The urgency you feel to silence the alarm, to begin the day, to swing into motion, is habitual rather than biological. Your body does not actually need you to be vertical in that first moment. What it needs, what your cardiovascular system specifically needs, is a few seconds of transition between the low-power state of sleep and the full demands of wakefulness. And you can provide that transition entirely from the position you are already in. Take 3 breaths. Slow, deliberate, full breaths. In through the nose, feeling the abdomen expand. Out through the mouth, slowly and completely. Not rushed, not perfunctory. 3 real breaths, each one taking approximately 5 seconds in and 5 seconds out. 15 seconds total. What are those breaths doing biologically? They are activating the parasympathetic nervous system, the branch of your autonomic nervous system responsible for calm, recovery, and balance. The parasympathetic is the physiological counterweight to the cortisol surge. When you breathe slowly and deliberately, you are not simply filling your lungs with air. You are sending a chemical message to your cardiovascular system through your vagus nerve, saying, steady, not emergency, not alarm, steady. The measurable effect of this, documented across multiple studies of slow, deliberate breathing upon waking, is a meaningful reduction in the blood pressure spike that would otherwise accompany the morning hormonal surge. 3 breaths, 15 seconds. A cardiovascular protective act of remarkable simplicity. Now, before your feet touch the floor, before you move to vertical in any way, I want you to drink water. This requires a preparation the night before, which I will ask you to make tonight before you sleep. Place a full glass of water on your nightstand, room temperature, not cold. Cold water on a digestive system that has been at rest for 8 hours can create a mild shock response that we want to avoid. Room temperature, a full glass. And before you stand, drink it, the entire glass, not a sip, not half, all of it. What does this accomplish? It begins the rehydration process immediately, before your cardiovascular system has to face the full demands of the day. It thins the blood, reducing viscosity and the clotting risk that peaks in those early morning hours. It gives your heart's pump better fluid to work with before you stand up and before the orthostatic challenge begins. The effect is not dramatic or instantaneous in the way that medication can be. It is gradual and physiological, but it is real and it is meaningful, and it costs you nothing but the habit of remembering. Some of my patients ask whether they can drink their morning coffee instead. I understand why they ask. Coffee is comfort, ritual, pleasure. But no, it cannot substitute here, and the reason is important. Caffeine is a mild diuretic. It promotes the excretion of fluid. Drinking coffee first thing in the morning, before water, actually continues and compounds the dehydration your body has experienced through the night, rather than beginning to address it. Coffee can absolutely remain part of your morning, just not the first thing. Water first. Always water first. Now you are 3 steps in. You have breathed. You have hydrated. And only now are you ready to address the transition from horizontal to vertical. And I want to give you a specific way to do this because the how matters as much as the when. Roll to your side first. Do not push yourself straight up from lying on your back. Rolling to the side reduces the sudden mechanical demand on your spine and your abdominal muscles, which indirectly also reduces the brief spike in intra-abdominal pressure that can accompany a direct sit-up motion and create its own small cardiovascular effect. From your side, use your arms to push yourself to sitting. Slowly. This is not a movement to rush. Sit on the edge of the bed with your feet hanging. Just sit. Do not stand yet. And while you sit, I want you to do something that I teach every patient over 60 as a matter of almost cardiovascular first principle. Rotate your ankles. 10 slow, complete circles in each direction. 5 one way, 5 the other. What is the anatomy here? Deep in the calf muscles, particularly the soleus, there is a dense network of veins that acts as a secondary pump for your circulatory system. When the calf muscles contract, even mildly, even in the controlled motion of ankle rotation, they squeeze those veins and push blood upward, back toward the heart. This calf muscle pump is one of the body's most important defenses against the blood pooling in the legs that occurs with standing. By activating it before you stand, while you are still sitting safely, you are preloading the return circulation, helping your heart receive adequate blood volume before it has to manage the full orthostatic challenge of being vertical. Sit for 30 full seconds. Not 3, not 5, 30. And if you feel any dizziness or unsteadiness as you sit on the edge of the bed, that is information. Do not ignore it. Take an additional 15 seconds. Let it pass completely before you consider standing. When you do stand, do it slowly. Press through your feet and your legs, use your thigh muscles to lift your body weight, and come to full vertical in a measured, unhurried way. Then stand still. Do not take your first step immediately. Stand still for 10 seconds, letting your blood pressure stabilize, letting your vessels complete their adjustment, letting your cardiovascular system arrive fully at its waking state before you begin to move through your home. That is the complete protocol. 3 breaths, 1 glass of water, roll, sit, rotate your ankles, 30 seconds, rise slowly, 10 seconds still, 90 seconds. Starting tomorrow morning, every morning, without exception. Now I want to take a moment and speak specifically to those of you who are taking a diuretic for blood pressure or for fluid management. Because there is an additional layer to your morning picture that deserves honest attention. Diuretics work by signaling the kidneys to excrete excess fluid. They are effective medications, widely prescribed, and in the right patients, genuinely important for cardiovascular health. But the kidneys do not excrete fluid in isolation. When they flush water, they also flush electrolytes. And among those electrolytes, the one that matters most for the heart's electrical stability is magnesium. Magnesium is not a mineral that receives much attention in general medical conversations, but in the context of cardiac function, particularly cardiac electrical function, it is profoundly important. Magnesium regulates the ion channels in the heart muscle cells that control the electrical signals coordinating each heartbeat. When magnesium levels fall quietly, as they do in a meaningful percentage of people on long-term diuretics, those electrical signals can become erratic. Palpitations, an irregular rhythm that comes and goes, a sense that the heart is occasionally stumbling or skipping, and these symptoms, when they occur, tend to be most pronounced in the morning, precisely when the heart is already under its greatest daily stress. If you are on a diuretic and you have ever noticed palpitations upon waking, or an irregular heartbeat in the early morning hours, or a general sense of cardiovascular unease that is worse in the morning and better by midday, please bring that pattern to your physician's attention. Ask them to check your magnesium level. It is a simple blood test. The result could be genuinely important. Magnesium deficiency is correctable, easily and safely, and doing so may make a meaningful difference to your heart's behavior during precisely the window that matters most. This is also a good moment to talk about something more broadly, which is the relationship between what you feel in the morning and what that feeling is actually telling you. Because there is a pattern I observe in my patients that genuinely troubles me, and it speaks to something cultural as well as medical. Over time, people develop a personal narrative of their own body. They learn what feels normal for them. They calibrate to their own baseline. And when something changes gradually, slowly, over months or years, that gradual change gets incorporated into the baseline rather than recognized as a departure from it. The slight dizziness on standing that began a few years ago and is now simply part of mornings. The occasional heart flutter upon waking that has been happening for so long that it no longer seems worth mentioning. The fatigue that is present every single day and has become, in the patient's mind, simply who they are now, rather than a symptom that might have a meaning and a cause. I want to invite you to look at your mornings with fresh eyes, not anxious eyes, not alarm, fresh eyes. Because the body communicates consistently, and it communicates honestly, and the most important skill I try to give my patients over 60 is the ability to hear those communications clearly, rather than normalizing them into invisibility. Consistent dizziness upon standing is not normal. It is orthostatic hypotension, and it is manageable. Regular heart palpitations in the early morning are not a personality trait. They are a rhythm disruption, and they warrant evaluation. A sense of pressure or heaviness in the chest upon waking, even mild, even brief, is never something to absorb into your daily baseline. It is a signal that deserves a conversation with your physician. Morning headaches upon waking, not the kind caused by poor sleep position but a deep, dull pressure that improves as the day goes on, can in some cases reflect blood pressure dynamics during the night that your daytime readings are not capturing. These are signals, not alarms. Signals, and signals exist to be heard. Your body is not working against you, it is communicating with you. And after 60, the language of that communication becomes both more nuanced and more important to understand. Let me return to Marguerite, because her story does not end on the floor of her bedroom. She survived. She recovered. She spent 3 weeks in a cardiac rehabilitation program and then came back to my office for a follow-up consultation. And the conversation we had in that consultation is one I carry with me because it was so honest, so clear, and so representative of what I hear from patient after patient. She said, "Dr. Sandrine, I did everything I was told. I took my medication, I exercised, I ate well, I went to every appointment, and nobody, in 20 years of being a patient, ever asked me about 30 seconds. And she was right. Nobody had. Not because her physicians were negligent, not because her cardiologists were not skilled and caring people, but because those 30 seconds, the transition from sleep to standing, had never been identified as a conversation worth having. It existed in a blind spot of modern medicine, too ordinary to examine, too habitual to question. She told me that when she learned the 90-second protocol during her rehabilitation, her first response was disbelief, not because she doubted the science, but because of the simplicity. "That's it?" she said. "That is truly all it takes?" And I told her what I am telling you now. Yes, that is truly all it takes. Knowledge applied consistently beginning the very next morning. The biology does not require more. Just 90 seconds of conscious respect for what your cardiovascular system is actually experiencing in those first moments of the day. 6 months after her discharge, Marguerite's morning blood pressure readings had stabilized meaningfully. The dizziness she had been incorporating into her mornings for years was gone. She told me she felt steadier, clearer, and more present in her mornings than she had in a decade. And she had started telling her friends. She had become, in her own quiet way, a carrier of the information she wished she had received 20 years earlier. That is what I am asking you to become today. Not a crusader. Not an evangelist. Just someone who carries this information forward to the people in their life who wake up every morning the same way Marguerite did, the way Douglas did, the way millions of people over 60 do every single day without knowing what the biology of those first 30 seconds actually looks like. Now I want to expand the conversation slightly, because the morning is not only about those 90 seconds, it is also a window during which certain other habits either protect or compound the cardiovascular risk we have been discussing. And I want to give you the complete picture. The first thing I want to address is the sequence of medications. Many of my patients take blood pressure medications in the morning, and they take them immediately upon waking, sometimes even before they have sat up. I want you to consider, if your physician agrees and your specific medication timing permits, whether taking your blood pressure medication after you have completed the 90-second protocol and had your water might be more physiologically appropriate. This is not a universal recommendation. Some medications are specifically timed for their first-thing effect. But for many commonly prescribed antihypertensives, the question of whether the medication should arrive in a system that has had 90 seconds of careful cardiovascular preparation versus one that has just lurched immediately to vertical is worth discussing with your prescribing physician. Bring this conversation to your next appointment. Ask, is the timing of my blood pressure medication flexible? And if so, when in the morning is best? That is a completely legitimate and important clinical question. The second thing I want to address is phone use in the first minutes after waking. This may seem far removed from cardiovascular physiology, but stay with me, because the connection is real. The first act of reaching for a phone in the morning, before the body has completed its transition to wakefulness, before the parasympathetic system has had any opportunity to counterbalance the cortisol surge, exposes the nervous system to an immediate stream of information, notifications, news, messages. The brain responds to that information with precisely the same stress hormones that are already surging from the natural waking process. Effectively, you are doubling the cortisol load at the moment of greatest cardiovascular vulnerability. The phone can wait 5 minutes, 10 minutes. The messages will still be there. Your heart will have had a gentler entry into the day. The third element I want to speak about is temperature. Many of my patients over 60 shower first thing in the morning, often with hot water. And hot water, while deeply comfortable and psychologically part of the morning ritual, causes peripheral vasodilation, a sudden opening of the blood vessels near the skin surface as the body responds to heat. This can cause a meaningful drop in blood pressure immediately after exiting a hot shower, particularly when combined with the already compromised orthostatic responses of the post-waking period. I am not telling you to give up your morning shower. I am suggesting that if you regularly feel dizzy or unsteady upon exiting the shower in the morning, consider making the water slightly less hot, exiting slowly rather than quickly, and sitting down on the edge of the tub or a shower stool for 30 seconds before standing fully. The same principle that governs the bed applies to the shower. Slow transitions protect the cardiovascular system. I want to speak now about something that lives deeper in the biology of aging, not as a detour but as essential context. Because understanding why the body after 60 responds differently to these morning stressors, not just that it does, gives you a relationship with your own physiology that goes beyond a checklist. The arterial stiffness I mentioned earlier is not simply a mechanical change. It reflects a complex interplay of biological processes that accelerate after 50 and 60. Chronic low-level inflammation, which is measurably higher in older adults than in younger ones, directly contributes to changes in vessel wall structure over time. Oxidative stress, the accumulation of cellular damage from decades of metabolic activity, affects the function of the endothelium, the delicate inner lining of your blood vessels, in ways that reduce their responsiveness and resilience. And the autonomic nervous system, which governs all the automatic cardiovascular reflexes we have been discussing, including the orthostatic reflex, gradually becomes less precise in its timing and its magnitude with age. None of these processes are your fault. None of them are evidence of failure. They are the biology of a system that has been working without pause for 60, 70, 80 years. But they are real, and they have real implications for how you approach the moments of greatest cardiovascular demand in your day. And the morning, as I hope you now understand more completely than you did an hour ago, is the single greatest moment of cardiovascular demand in any given 24-hour period. There are things you can do beyond the 90-second protocol that support your cardiovascular system's resilience across the morning window and throughout the day. I want to mention a few of them briefly, not as an exhaustive list, but as a framework. Consistent sleep timing matters more than most people realize. The cortisol surge that precedes waking is calibrated by your biological clock to begin approximately 60 minutes before your habitual wake time. When your wake time is erratic, when you sleep until 9 on some mornings and rise at 6 on others, the biological clock cannot set the surge timing accurately. The result can be a hormonal wave that arrives at an unpredictable moment, sometimes hitting full strength before the body has had adequate sleep. Consistent sleep and wake times, even on weekends, support the precision of the circadian system and reduce the unpredictability of the morning surge. Hydration throughout the day, not just the morning glass of water, directly affects the viscosity of blood you wake up with the following morning. If you end your day mildly dehydrated, which many older adults do because the sensation of thirst becomes less reliable with age, you wake up more dehydrated than if you had maintained good fluid intake throughout the previous day. Aim for consistent fluid intake across the day, with most of it taken before 6 in the evening to avoid disrupting sleep. And yes, the morning glass on the nightstand remains the first and most important act. Regular moderate physical activity, and by moderate I mean walking, not marathon training, maintains the responsiveness of the orthostatic reflex by keeping the cardiovascular system conditioned to the demands of movement. The calf muscle pump I described, the one you activate with ankle rotations before rising, remains more robust in people who walk regularly than in those who are largely sedentary. Movement is medicine for the vascular system in ways that are specific, measurable, and deeply relevant to morning cardiovascular safety. And finally, the conversations you have with your physician. Bring this information to your next appointment, not as a challenge or a confrontation, but as a collaboration. Ask your doctor to check your morning blood pressure readings, not just an office reading at 2 in the afternoon, but readings taken at home in the first 15 minutes after waking and standing. Many people have blood pressure that is perfectly controlled at noon and significantly elevated in the morning window. That pattern, called morning blood pressure surge, is clinically meaningful and has direct implications for medication timing and dosing. Home blood pressure monitoring, done correctly and consistently, gives your physician information that a once-yearly office visit simply cannot provide. Ask about your magnesium if you are on a diuretic. Ask about the timing of your medications. Ask whether your morning cardiovascular risk has ever specifically been discussed as part of your care. These are legitimate clinical questions, and a good physician will welcome them. Let me bring everything together now, because I want you to leave this conversation with complete clarity, not just on what to do, but on why it matters, why it is within your reach, and why it begins not next week, but tomorrow morning. The morning, that 60 to 90-minute window from the first stirring of the cortisol surge to the moment you are fully upright and moving through your home, is the most significant cardiovascular stress event in your daily biology after 60. 3 forces arrive together during that window. The hormonal surge of cortisol and adrenaline pressing against vessel walls that are stiffer and potentially carrying silent plaque. Blood that is thicker and more prone to clotting after a night without hydration. And the orthostatic challenge of standing up, which demands a rapid cardiovascular adaptation that slows with age and can produce a dangerous compensatory spike in a heart already under stress. These 3 forces are real. They are not theoretical. They are the biology that explains the statistics every cardiologist knows. Cardiac events cluster in the morning with a pattern that is not random, but is perfectly consistent with these physiological mechanisms. And the response, the 90-second morning protocol, is as real as the danger it addresses. 3 slow, deliberate breaths immediately upon waking, activating the parasympathetic system and beginning to counterbalance the cortisol surge. 1 full glass of room temperature water, drunk before standing, beginning the rehydration process and reducing blood viscosity and clotting risk. A slow roll to the side, a push to sitting. 30 seconds on the edge of the bed with ankle rotations to activate the calf muscle pump, followed by a slow rise to standing and 10 seconds of stillness before the first step. 90 seconds, every morning, beginning tomorrow. Tonight, before you sleep, place a glass of water on your nightstand. That is the only preparation required. And tomorrow morning, when the alarm sounds, you will have everything you need to do something genuinely protective for your heart. Something simple, free, evidence-based, and almost completely unknown among the people who need it most. I think about Marguerite often, about the Tuesday morning that did not have to happen the way it did, about the 30 seconds that nobody had ever thought to discuss with her in 20 years of diligent medical care, about the conversation we had in the follow-up and the way she said with a clarity I found both moving and instructive, "I just wish someone had told me sooner." You have been told. And I want to ask you something, not as a physician issuing a directive, but as someone who has sat beside too many patients in recovery rooms and talked about mornings that could have gone differently. Will you put the water on the nightstand tonight? Will you take 90 seconds tomorrow morning before your feet touch the floor? Because those 90 seconds are not a burden. They are a conversation you are having with your cardiovascular system, a signal you are sending to your own body that says, "I am paying attention. I understand you. I am going to give you what you need before I ask anything of you." Your heart has been working for you, without pause, without complaint, without asking for anything in return, for every minute of every hour of every day of your entire life. It kept beating while you slept, while you grieved, while you laughed, while you worried, while you lived. 90 seconds in the morning is not a sacrifice. It is a gesture of respect toward the most faithful organ you have. Take good care of it. It deserves nothing less. And so do you.